My name is Matthew Levin. I'm going to be taking a short video today on vital signs, and the video is going to comprise of waist to hip ratio, respiratory rate, heart rate, and blood pressure. My patient's name is Benjamin Levin, and today. Hello again. This is my patient Benjamin, and we're going to be taking his heart rate. So can I have your right hand? I'm going to place my hand under his right wrist and have the index and third finger over his radial pulse. His radial pulse is there. I can feel it now. Now his radial pulse is regular and strong. So what we're going to do is now take his heart rate. I'm going to continue with the first trial right now. Great. That was 17 beats per minute times 4 is 68 beats per minute because I did it for 15 seconds. Next, we're going to be checking for my patient's respiratory rate. And what we're going to be doing is I'm going to have my patient just breathe normally for a minute and see how many breaths he's going to be taking. So I'm going to start the clock and we'll see how many breaths. And go. Notice the chest as he's taking inhalation and exhalation. And I just counted that, and it was 15 breaths in 1 minute. And that falls within normal range of the average adult male. Now we're going to be taking my patient's blood pressure. And for this, I'm just going to be asking a couple questions regarding his past history and his habits right now. So, have you had any history of high cholesterol?
No.
What about high blood pressure?
No.
Are you a smoker?
No.
Do you have any history of diabetes mellitus?
No.
And do you have any pulmonary disease such as asthma? Are you taking inhalers for asthma?
No.
Okay. So first, I'm going to have the patient sit up straight, legs not crossed, in an upright position. I'm going to have him take his arm and just place it gently on the table. Normally we would have the patient his arm would be at his heart level, but we have a few inches off, and I think that'll be okay to distinguish his blood pressure. So what we're going to do is we're going to take the cuff, the blood pressure cuff, and we're going to put it right above his cubital area of his arm. And we're going to check to see if he's in that okay range for the adult. And he looks like he is in that range. I want to make sure that so it's not so tight. And we also want to give a 2-finger check just to see what that is. So that was a little loose there, so I'm going to tighten it just a little bit more. Good. So what I'm going to do here, I'm going to place the blood pressure reading here. I'm going to put on my stethoscope. I'm going to place this on the brachial artery. You can find the brachial artery about 4 centimeters above the medial epicondyle. So I can feel his brachial pulse right there. I'm going to slide the stethoscope under here. pump up the blood pressure cuff to about 180 millimeters of mercury. I'm going to slow it down. I'm going to hear for that first Krakow sound. And great. So the first trial, my patient's blood pressure was 110/78, which definitely falls well within the range of normal. Normal is about 115/75. So we're just going to take a few minutes to let his blood pressure stabilize, and then we're going to do a second trial. We're going to be taking the waist to hip ratio. And how we calculate that is we have 2 points. We have 1 point 2 inches above the umbilicus, right at the 12th rib, and then we also have one right at the hip, the greater trochanter. So what we're going to be doing is you're going to have your patient hands down right by his side, and then we're going to be taking a tape measure, and we're going to be measuring the first point. You want to make sure not to do it as tight, just a gentle little measure right over that area. So that measures 31.5 inches. First measurement. And for a second measurement, hold your arms up. And then slide them back down. $39.5. And then to calculate the waist to hip ratio, you just divide his waist and his hip. So you divide 31.5 divided by 39.5, and we get 0.79, which falls well in the range of a normal male. I'm here to discuss the vital signs assignment, and let's get off by saying that I only recorded just one trial on video, but after the video had ended, I continued and did all 3 trials for each 4 vital signs. Let me start off by saying I was a little nervous during the video, but I felt like I did the necessary steps to correctly understand and observe and determine my patient's vital signs. So I'm just going to discuss briefly each one of them. So the heart rate normal range is between 60 and 100. So he did not show any indications that he was in bradycardia or tachycardia. And that was for heart rate. His heart rate was an average of 69 beats per minute. Resting respiratory rate, there was a little mix-up. I proceeded to tell the patient or describe what was going on, but during that time he did forced inhalation, but we did it again and repeated the trial outside the video, and it seemed that his resting respiratory rate was 13 breaths per minute. So that also falls in well within the normal range of 12 to 20 breaths per minute. and his blood pressure. His blood pressure was taken at an average of 106 over 70, which is, again, falls with normal range, which normal is about 115 over 75 for a normal adult male, and did not show signs of hypertension or hypertension. And just to go back to the respiratory rate, he also did not show signs of brachypenia or tachypnea. And for the waist to hip ratio, I also observed a little error during my video about I did measure correctly at the beginning 2 inches above his umbilicus, but I did measure, it looked like a little under, so 1 inch. So human error, it could have been a little less, his waist, but overall his waist to hip ratio was 0.8, and that definitely falls, and that's a low risk for a person, below 0.9 for a male and below 0.7 for a female. And I was really excited and hope to do better on upcoming assignments.